Hello and welcome to the Mayor's Monthly Notable Nonprofit. I'm here at the Free Medical Clinic in Iowa City with co-director Sandy Pickup. Thanks so much for being here, Sandy.
Thank you.
So can you explain what the Free Medical Clinic is?
Well, first of all, we're old. We're one of the oldest free clinics in the country, and we are certainly the oldest free clinic in Iowa. We provide free health care to people that don't have insurance or for some other reason aren't able to access health care in other facilities.
So being one of the oldest facilities in the country, how long has the clinic been around?
1971, March of 1971, a group of community people got together and decided to start a free clinic. It was quite popular actually in those days, you know, to start different social movements, were afoot, and free clinics was one of the big things that was kind of going around then. And
yeah, well,
healthcare is a basic human right, you know.
Yeah, definitely. Around that period of time, I think the domestic violence intervention program came out, and the rape victim advocacy program.
Yeah.
And was this one of the projects that came out of the Women's Resource and Action Center's roots?
Not directly, but I think, you know, indirectly there were lots of the same people involved in those kinds of social movements.
Wow. So now here we are sitting in 2010, and I imagine over the years the amount of people you've served has changed. Have you seen the need increase for free medical services?
Unfortunately, yes. I think in the early days, you know, the primary reasons that people came to the clinic were maybe birth control or sexually transmitted disease-related things, maybe just, you know, basic colds and flu. We now see, you know, over 300 people just because they have chronic health problems and they're not able to get their health care services met any other way, diabetes, hypertension, things like that. So we basically are the family physician for many, many people in the area.
Is it actually free, or do people pay what they can?
The services are free. We do ask, though, that people make a donation if they feel they can do that. It doesn't cost nothing.
Yeah.
It does cost money to run the place. We have staff and some of the medications and the supplies that we need cost money.
So are medications donated and supplies donated? Who are some of the contributors to this organization?
Well, the University of Iowa provides the kind of lab testing things that we need. Medications we get from the drug companies. We have actually a staff person that applies to the drug companies so that people can get free medications. And then some supplies are donated. Mercy Hospital is quite generous with supplies and medications and things like that. But we do have to purchase some of those things as well.
Do you have some statistics on the number of people that you see on a weekly, monthly, yearly basis?
Annually, we see about probably 2,600 people. And as I said, many of those people come here for chronic ongoing problems. And so we'll have maybe 6,500 patient visits. So, you know, people that have come repeatedly and use the service.
I had a friend whose son was developing some asthma-like symptoms, and she doesn't have insurance, and she said, well, you know, I feel like I need to take him to the doctor. We don't have insurance. I kind of don't know what to do. And I said, well, you know, I'm pretty sure that free medical clinic's the kind of place that you can take him to. In that kind of situation, a child where they're able to maybe get some state coverage. Are children? Do you see many children here?
We don't see very many children here because the Hawkeye is available, the state insurance program for kids. But we do see some children, and things like asthma and things like that. We don't do childhood vaccinations. We used to do that, but now we really try and steer people to other facilities that so kids can have a better medical home. So go to a pediatrician or something.
And you also have a dental clinic. So what's the story behind the dental clinic? It's not open all the time, I understand. But
any of our services are really dependent upon the volunteers that we have available to see people. So if we don't have a dentist, then we don't have a dental clinic. But the dental clinic is open most Monday and Thursday evenings. And they can see 2 or 3 people every evening. And they do very basic, pull your teeth, do some cleanings, things like that. It's, if people haven't had dental hygiene or dental care for some time, it really complicates the visit, you know, because there's so much wrong that they just can't do everything all at one visit.
So what are the annual operating costs for the free medical clinic?
We have about a $400,000 budget, you know, a major portion of that being salaries. We have 5 full-time and 5 part-time paid staff. Our medical director is part-time, and we have a couple of other medical people that are part-time. You know, it might seem odd that you would have paid staff in a primarily volunteer-run clinic, but it takes a full-time person to get all those volunteers and schedule the volunteers and make sure that the volunteers have liability coverage. There's a state program that we utilize that, you know, you have to do a lot of paperwork and things like that. So that takes a full-time person. And, you know, I full-time seems like go to meetings and look for money and look for resources to keep the place going. And you know, the major funders are the county and United Way of Johnson County, and then we get money from the city of Iowa City, from Coralville, from private donations, and as I said, patient donations, and we write some grants for different kinds of small programs and things like that.
And this is the only free medical clinic kind of in the...
Well, in Johnson County,
In Johnson County.
There is a large free clinic in Cedar Rapids and then a smaller free clinic in Cedar Rapids. But there are about 30 free clinics in the state of Iowa now, and we're sort of peripherally associated with a group called Free Clinics of Iowa, and they get calls almost weekly about people wanting to open a free clinic in their small town or something. You know, their services are so needed that you know, people are just trying to put together whatever they can to make sure that people have some access to health care. And so most of the free clinics in Iowa are open maybe one night a week, you know, so they're very small and they're completely volunteer driven. But we're fortunate in that we've been here with such good community support that, you know, we're able to be open more days a week.